Next award is the Health and Wellbeing Award. This award is sponsored by our presenting partner, GLYDE Health. To present the award, would you please welcome Clive Woodward, Managing Director of GLYDE Health, and Anthony Shrembry, CEO of St Vincent's Hospital in Darlinghurst.
Good evening, everyone. It's always a great pleasure to represent my company at these awards, and I'm delighted that our enduring partnership with ACON Health continues into its 13th year. Producing the Stay Safe condom and lubricant for ACON Health for many years emphasises that we cannot, indeed must not, become complacent about sexual health. The reoccurrence in recent times of two major STIs, syphilis and gonorrhea, which were once managed by penicillin, have now arisen as superbugs. This reminds us that complacency is not an option. Sexual health is paramount. My company's role is to ensure that the sexual sensuality is not diminished and the protection is enhanced. Thank you.
Gregory PHILLIPS, for 25 years of leadership in Aboriginal and Torres Strait Islander health as a Professor of First Peoples Health and serving on several boards and committees, including chairing the Cathy Freeman Foundation and Australian Health Practitioner Regulation Agency. Michelle GUTTMAN-JONES, for her work as a community campaigner for trans and gender diverse health with Australian GPs and supporting a campaign to increase the accessibility of healthcare for trans and gender diverse people across Australia. Gary DRISCOLL, for over a decade of striving to improve the culture, understanding and awareness of LGBTIQ communities, both within and external to Surf Life Saving Australia, through his involvement with Lifesavers with Pride. Cristyn Davies, for internationally renowned work in sexuality and gender diverse health research, especially regarding young people, through various institutions and community health organisations, and for her passion to improve the health and well-being of young LGBTIQ people on a global scale.
So it's my great pleasure to announce the winner of the 2019 Health and Wellbeing Honour Award goes to Cristyn Davies.
So someone said that was one of my favourite songs, clearly, which it is actually. I feel very humbled to be receiving this award this evening, and I'd like to acknowledge the esteemed nominees in this category, Gregory PHILLIPS, Dr. Michelle GUTTMAN-JONES and Gary DRISCOLL. I really feel like I'm in fine company. As some of you may be aware, I'm a board director at 2010 Incorporating GLCS New South Wales, which is a real privilege for me. I learned so much from engaging with my colleagues on the board and with our amazing co-executive directors, Jane Morley and Terence Humphreys, and our passionate staff. And I'd like to thank Warner and Mon for coming to support me this evening. Given my expertise in child and adolescent health, volunteering at 2010 allows me to use my skill set in accessible and impactful ways for our communities. I'm particularly committed to closing the gap between research and its translation into policy and practice to impact the health and wellbeing of gender and sexuality diverse young people. So one example of this that some of you may have seen is Well Played, Young, Proud and Active, which is a campaign and a short film from 2010 highlighting the importance of diversity and inclusion in sport and physical activity and the positive impact it has on young people's health and well-being. I was lucky enough to co-produce the film with my talented board director colleague and journalist Mon Shafter and the filmmakers Luke Cornish and Mick Elliott. Well Played shows us that sport and physical activity is for everyone and that we need to get active about diversity and inclusion. Well Played will be part of a suite of resources to support the guidelines for the inclusion of transgender and gender diverse people in sport developed by the Australian Human Rights Commission in partnership with Sport Australia and the coalition of major professional and participation sports. More recently, I advocated for our communities at the United Nations Human Rights Council in Geneva. A highlight of the 41st Council session was the renewal of the mandate of the independent expert on protection against violence and discrimination based on sexual orientation and gender identity. Having worked alongside human rights defenders from around the globe for the months leading up to the Council session, it was quite a victory to witness the mandate's renewal at the end of the 41st Council session. It was also an opportunity to witness the Australian government successfully work to support the human rights of people of diverse sexual orientation and gender identity. During my time at the Human Rights Council, I also advocated for the health and wellbeing of our communities in consultation with many amazing people and organisations in this room, and I thank you so much for your support of me personally. I focused on the most pressing health issues and wellbeing issues in an effort to create positive change. So while all the statements I delivered at the Human Rights Council continue to have resonance, tonight I want to draw attention to my message about trans, gender diverse and non-binary young people who are particularly stigmatised and discriminated against when trying to access safe healthcare. Thank you. I'm sure many of you will know that recently there has been an intensified cycle of negative media reporting in Australia about trans and gender diverse people and their access to culturally safe healthcare. This reporting focuses on clinical approaches to gender-affirming healthcare, trans and gender diverse people generally, and young trans and gender diverse people more specifically. We know that reducing discrimination within health, legal, social, education and community settings is essential to improved mental health and wellbeing. We also know that for young people, accessing timely, culturally safe medical gender affirmation through publicly funded multidisciplinary services is critical. High costs and long wait lists prohibit timely access to medical affirmation, increasing the risk of poor mental health. All gender-affirming care must centre on the right and expertise of all people, including young people, to self-determine their own identity. I look forward to continuing to advocate for our communities alongside all of you, and thank you for sharing your expertise with me and for your ongoing support. Thank you so much.